Advanced reproductive technology options are designed to help create a family. This video is intended to show you how this can be achieved. Dr. Lori Arnold has specialized in reproductive medicine since 1992. She has extensive experience working with couples or individuals in the same situation that you find yourselves. Dr. Arnold is located in beautiful San Diego on the scenic Southern California coastline at her state-of-the-art embryology lab and surgical center. Whether through the use of IVF, PGD, or third-party options such as surrogacy and egg donation, increasing your knowledge on these options will help you decide the best option for yourself. At CACRM's state-of-the-art IVF laboratory, patients can be provided with options such as ICSI, intracytoplasmic sperm injection, which assists in the fertilization of each individual egg with one individualized sperm. They are also able to develop state-of-the-art blastocyst cultures, which studies have shown create higher pregnancy rates when the embryo is transferred at this stage, as well as pre-implantation genetic diagnosis, or PGD. Pre-implantation genetic diagnosis is a technique used to test embryos for specific genetic disorders prior to their transfer into the uterus of the intended mother or into a gestational surrogate. This advanced genetic screening of over 140 genetic diseases is intended to help identify couples with potential hereditary genetic disorders to determine which embryos may affect any resulting children. In order for PGD to be performed, a couple undergoes an IVF cycle, or in vitro fertilization, in order to obtain eggs that are fertilized using ICSI and grown in the IVF laboratory for 5 to 6 days when the embryo is at a fully expanded blastocyst stage of development. A highly skilled embryologist at CACRM then uses a state-of-the-art microscope setup to extract cells from the outer layer of the embryo, called trophectoderm cells. Note that only a few cells are extracted with no damage to the remaining embryo. These cells are then analyzed, and the results from each cell are used by CACRM's embryologist to determine which of the embryos are affected with the genetic trait or have abnormal chromosome number. Dr. Arnold's lab can also perform pre-implantation genetic screening, or PGS, which is the screening of the embryo for abnormal chromosomes or an aneuploidy. With newer technology, screening all 24 chromosomes can be evaluated. Aneuploidy screening appears to be most beneficial for certain women, including women of advanced reproductive age or who have recurrent pregnancy loss. Specifically, one of the most common reasons to have PGS performed is to lower the risk of having a child with a chromosomal abnormality, such as Down syndrome or trisomy 21. PGS can be used for gender screening. Dr. Arnold's laboratory can determine if the embryo is a male, if the embryo has XY chromosomes, or if the embryo is a female and has 2 X chromosomes. This may be helpful for X-linked diseases or even for family balancing. Furthermore, genetic testing of the pre-implanted embryo can determine whether the embryo could be affected by a chromosomal abnormality or aneuploidy, which is the most common cause of miscarriage in humans. For example, 3 of chromosome 16 or 3 of chromosome number 22 are the most common abnormalities diagnosed in miscarriages, which is why screening the embryo for abnormal chromosomes can potentially lower the risk of miscarriage. Therefore, this may be helpful in all ages of patients, including the egg donor population. In the case where it is determined that you need an egg donor to have your baby, the egg donor is chosen through an agency or through the clinic. Once you have selected an egg donor, she must undergo an extensive evaluation to determine if she is a good candidate. The evaluation consists of blood tests looking for hormonal levels, genetic testing, and an ultrasound to look at the normalcy of the egg donor's ovaries. Your egg donor will then undergo medications to stimulate her ovaries in order to produce more than one egg. At the optimal time, Dr. Arnold will then proceed to the egg retrieval, at which time the eggs will then be fertilized in the laboratory with the sperm provided by either the intended father or a sperm donor if needed. Dr. Arnold and her staff at CACRM also work with gestational surrogates, which is the process where a woman carries and delivers a baby for another couple or person. This is a woman who is not biologically related to the child. As you can see, Dr. Arnold's passion is to help people create the family that they have always dreamed of. With CACRM's expertise and knowledge, having a child is definitely in your future. At the initial stage, the surrogate undergoes a psychological and medical screening to ensure that she is psychologically stable and in good health to carry your baby through the process. The medical evaluation includes testing for hormonal studies, infectious diseases, vaccinations, and a urine analysis for drug and alcohol. She also undergoes a detailed evaluation consisting of an ultrasound for her ovaries and her uterus. We do a hysteroscopy that evaluates the uterine cavity to examine exactly where the embryos will be transferred. Her IVF success rates exceed the national average thanks to her medical experience, skilled laboratory, and individualized personal care to each and every patient. It is through her dedication that she and her staff is able to create families for many, just like you. For more information, please contact Dr. Arnold and her caring staff at CACRM at www.cacrm.com to find out which possibilities exist for you and your future family.